When I say loneliness and social isolation, what immediately comes to mind? Both of these concepts actually go hand in hand, so they're not really definitive without each other. Loneliness is the mental experience that arises from the loss of meaningful and valuable interaction, whereas social isolation is the limited or complete lack of intentional relationships with other groups of specific people. The way I like to see it is social isolation is the objective aspect of loneliness where we're seeing actual proof that someone is lonely, whereas loneliness is the subjective feeling of loneliness. How do those aspects affect mental health in older adults? It is found that feelings of loneliness are associated with mental health issues like depression, anxiety, and cognitive decline. And for those who fail to adapt to environment, especially when we have and we're seeing older adults that are placed in residential care, psychological issues may arise, including, again, depression, anxiety, but now also low self esteem and loss of motivation just because of the new environment and that impact it has on their mental health. How does this topic challenge healthy aging?
Aging is not only a physical journey, it's also an emotional and psychological one. Mental health shapes whether older adults see this stage of life as meaningful or it could be a burden for them. For example, two older adults that might be experiencing the same physical changes could view this experience differently. For one with a stronger mental health, they could view this with acceptance or they could adopt positively, and they can still find joy in their daily lives despite their physical challenges and changes. However, one with struggling mental health may feel hopeless or withdrawn, which can make these physical changes seem overwhelming for them. In other words, mental health doesn't just influence how the body feels, it also colors how they perceive their life. It determines whether aging is experienced as a time of resilience, growth, and connection, or as a time of decline and isolation. This is why nurturing mental health is just as important as caring for the body in the journey of aging. Since mental health may not only influence emotions, it can also directly affect the body too. For example, when someone feels depressed or isolated, they might lose the motivation to stay active, they might skip their meals or avoid going to their appointments, and over time, that can lead to muscle weakness, poor nutrition, and even more health problems.
What are social determinants of health and how do they affect older adults' mental health?
Good question. So it's more than just about your mood or emotions. Mental health can be influenced by many social factors in your life, and these are called social determinants of health.
Can you give us some examples?
For sure. So, for example, if someone lives alone, they might feel lonely or isolated, especially after losing a friend, a partner, or even family. So, that lack of regular connection can lead to depression or anxiety for many older adults. Income also plays another big factor. If you're worried about paying bills or can't afford basic needs like housing, medication, or healthy food, your mental well being can also suffer.
How do you think access to healthcare affects older adults and their mental health?
Yeah, so your ability to access healthcare matters too. If it's hard to get appointments or there are long wait times, mental health concerns might go untreated. Ageism, or being treated differently just because of your age. This can also negatively impact your self esteem and your confidence, and can also affect your mental health well being.
What is the CCPNR?
The CCPNR is basically a standard of practice in the legislation that outlines the expectations and topics that nurses in Alberta need to follow in order to give good and safe care. These topics can include trauma-informed care, where individuals would essentially, we would approach them as if they all have experienced trauma, and that would mean that we would need to treat them with both care, sensitivity, and to create a safe environment for them, such as naturally trauma has negatively impacted mental health with anybody, and even more so with older people as they have experienced a longer life. It would ensure safety and comfort for all patients that have experienced all such traumatic experiences. Trauma can affect mental health with war veterans as they remain stoic, quiet, and grounded and reserved. These type of incidences could create alcohol issues and maybe further complications in their later years. And those are just some of the traumatic impacts that mental health can bring to older people, as well as neurological issues, schizophrenia, dementia, and Alzheimer's, among others. And lots of these go uncounseled and can create also even anger issues. So not only just these neurological issues, but creating even more personality instances with their anger issues, violent outbursts, or even untreated traumatic experiences, which is what the CCPNR aims to avoid by creating a safe outline for nurses to follow so that we can prevent these things from happening. Another topic with the CCPNR is that it can be harmful and create harmful behaviors that can include violence, bullying, emotional and physical abuse, and create hostility in the workplace. And by creating an unsafe workplace, it can make older people more distrusting towards their healthcare providers, especially if they have ever created harm towards them or even received by them. This can create a negative outlook, and this negative outlook can influence a senior's way of approaching normal daily activities, creating an insecure mental health and mental state, or perhaps even anger towards their healthcare professionals. And this anger can stem to even abuse or even more harmful behavior, which is what we aim to avoid. Their outlook on life would be important and to focus on, since this harmful behavior can lead to even causing depression and can potentially harm others around them or even themselves when they're alone, which is what the CCPNR aims to avoid. Another topic of the CCPNR is that they tell us to build a culture of humility with our patients, especially when younger nurses or just the younger generation, we were taught to always respect our elders. And this type of mental state can help us bring and create interpersonal relationships with others where we would gain empathy and even connections from older people, knowing their stories, their experiences, and building a good rapport from them, knowing that they are a generation before us. And that in itself can help us understand them better for how they were brought up and not lead to any prejudice towards them and for them to have any prejudice towards us. And this can impact the mental health towards them, solely how humility with them can build empathy and have a good relationship with them because of that empathy that we give, and also the empathy they give towards us for trying to build a trust with them. The culture they grew up with is very different from us, so that in itself would give them a different perspective, and for us to respect that different perspective and understanding that their mental mindset comes from the generation and their own upbringing, and to reflect on that and to implement that in the way we care for them. With mental health, the CCPNR talks about self-care as well. And that self-care is for us to always ensure that they're comfortable, that they're not going to be alone, that they're not going to have further neurological problems on our own doing. We need to do whatever we can to prevent that. And things such as, and normal activities can include knitting, singing, dancing, baking, whatever hobby an elderly patient would like to do, just do it. That self-care with them, is going to build a positive and safe environment with them so that they always have a positive outlook on not just their nurses but on themselves as well. This type of wellness will improve gradually or even drastically. It's to ensure that they're happy and are always going to give themselves a positive outlook and mental health from them, and to keep them active as well with others, as connections with others can benefit their own mental state and in turn perhaps improve their own physical wellness.
What myths or misconceptions exist about this topic?
Myths and misconceptions, well, there are many myths and misconceptions about mental health in older adults that can lead to failure to diagnose, stigma, and lack of treatment. And some common myths are depression is just a normal part of aging, or memory loss is always part of aging. These myths matter because it helps reduce stigma and encourages early detection and treatment and promotes better quality of life within the older community, and to also avoid that prejudice that we approach with them and give them a safe and positive environment.
How does mental health contribute to healthy aging? When an older adult feels supported and has a healthy mental health, it encourages them to have healthier habits, like staying active, eating well, and keeping their social ties. Even the body's stress response is directly linked to their mental health. Chronic stress or anxiety can raise their blood pressure and also weaken their immune system, while positive mental health can actually help their body recover faster. Positive mental health also helps build resilience. So when challenges come, like illness or loss, people can cope and still find meaning in their life. Additionally, a strong mental health also helps protect memory and cognitive function, which means older adults can stay independent, which can lower their feeling of helplessness. In short, a healthy mental health doesn't just add years to life. It indeed adds quality to those years.
How do you think nursing students like us can raise awareness about mental health in older adults? I feel like promoting social engagement and support within the community is a huge part in battling this. By advocating for social activities and events like game nights and karaoke nights, even, as well as having support volunteers and peer programs from all around the community, we can engage our older adults in being more socially active and participating. We can also start implementing and utilizing technology in these healthcare communities for better connection, especially when, like for example, when family is away and not near where these facilities may be. It's really beneficial when we start implementing technology where they are able to connect with them via messages, phone calls, video calls even. The most important aspect is educating the public as well as healthcare professionals alongside nurses about health impacts that loneliness, social isolation, and just mental health in general. Really being there for our most vulnerable and giving them the support that they need from us. What's a message or a lesson that you'd at least want an older adult to take away from this exploration?
We want you to know that all these factors are not your fault. They are part of the world around us. But the good news is help is available. Connecting with others, talking to your health provider, or using community resources can make such a big difference. If there's one thing we want you to remember, it's this. Mental health matters at every age. You're never too old to get support, and reaching out is a sign of strength, not a weakness.